Withdrawing medication from a vial and ampule. Obtain medication record, drug card of patient. Wash hands. Prepare equipment and assemble in medicine room. Withdrawing medication from an ampule. Tap of ampule lightly and quickly with finger until fluid leaves neck. Place small gauze around neck of ampule. Snap neck of ampule quickly and firmly away from hands. Hold ampule upside down or set it on flat surface. Insert needle into center of ampule opening. Do not allow needle tip of shaft to touch rim or ampule. Draw medicine quickly. Aspirate medication into syringe by gently pulling back on plunger. Keep needle tip below surface of liquid. Tip ampule to bring all fluid within reach of needle. If air bubbles are aspirated, do not expel air into ampule. To expel excess air bubbles, remove needle from ampule. Hold syringe with needle pointing up. Draw back lightly on the plunger and then push the plunger upward to eject the air. Do not eject fluid. Recheck fluid level in syringe by holding it vertically. Cover needle with its sheath or cap. Change needle on syringe. Now we go withdrawing medication from a vial with solution. Remove cap covering the top of vial to expose rubber seal. Firmly and briskly wipe the rubber seal surface with alcohol swab and allow to dry. Remove needle cap from syringe. Pull back plunger to draw amount of air into syringe equivalent to volume of medication to be aspirated from vial. Set vial on a flat surface and insert needle tip through the center of the rubber seal. Inject air into the vial, holding on to the plunger firmly. Invert vial, keeping firm hold of syringe and plunger. Keep tip of needle below fluid level. Allow air pressure from the vial to fill syringe gradually with medication. Then pull back plunger slightly to obtain the correct amount of medication. When desired amount has been obtained, position needle into vial's airspace. Top side of syringe to dislodge any air bubbles and eject the air into the vial. Remove needle from vial by pulling back on barrel at syringe. Hold syringe upright at eye level and ensure correct volume and absence of bubbles. Tap barrel to dislodge any air bubbles. Pull back plunger slightly, then push air out. Do not eject fluid. If medication is to be injected into client's tissues, change needle to appropriate gauge and length according to route of medication. For multi-dose vial, label with date of opening, mixing if any, concentration per ml, and nurse's initial. Now we go to vial containing a powder form. Remove cap covering vial of powdered medication and cap covering vial of diluents. Swab both caps with alcohol and allow to dry. Draw up diluents into syringe, following the step that we have with aspirating medications from a solution. Remove needle cap from syringe. Pull back plunger to draw amount of air into syringe equivalent to volume of medication to be aspirated from vial. Set vial on flat surface. Now set vial on the flat surface and insert needle tip through the center of the rubber seal. Inject air into the vial, holding onto plunger firmly. Mix medication thoroughly. Roll in palms. Do not shake. When drawing up medication into syringe, remove needle cap from syringe, pull back plunger to draw amount of air into syringe equivalent to volume of medication to be aspirated from vial. Right, so we have set vial on flat surface and insert needle tip through the center of the rubber seal. Inject air into the vial, holding on to plunger firmly. Invert vial, keeping firm hold of syringe and plunger. Keep tip of needle below fluid level. Allow air pressure from the vial to fill syringe gradually with medication. Then pull back plunger slightly to obtain the correct amount of medication. So when desired amount has been obtained, position needle into the vial's airspace, top side of syringe to dislodge air bubbles and inject the air into the vial. Anyway, this will be discussed when we will be having the lecture on demonstration of withdrawing and aspirating medications from a vial. Alright, so we hold syringe upright at eye level and ensure correct volume and absence of bubbles. Top barrel to dislodge any air bubbles. Pull back plunger slightly, then push air out but do not eject fluid. Again, if medication is to be injected into client's tissues, then you have to change the needle to appropriate gauge and length according to route of medication. So you are now ready to administer the medication with your medication tray, your medication card, your cotton balls with the alcohol and dry cotton balls, and then you can now bring the medication to the bedside. Right, so you have to dispose of soiled supplies, broken ampoules, and or used vials in special containers for glass and sharps and even syringes, and discard this equipment that you have used in proper container. This is now your aftercare, and then wash your hands. You are now ready to wash your hands. So that is withdrawing and reconstituting medications from ampoules, vials in liquid form, and in reconstituting vials in powdered form.